Hi, I'm Jared Thompson, and welcome to the finale of pain. Let's talk about how a physical therapist treats pain. After evaluating the root cause of the pain, the first step is to educate the patient on why they hurt, how long they can expect recovery to be, and what they can do to take action, and provide motivation on a brighter future ahead of them. On day one, or the same day as the physical therapist does the evaluation, they should do their best to reduce the patient's pain as quickly as possible through manual therapy or exercise, even if it's gentle, to turn down that doorbell that keeps ringing that we spoke about previously. Examples of exercise includes walking, running, weightlifting, controlled breathing, and more. The interesting thing is that even activity just like walking for 5 or 10 minutes can actually cause less pain because it gets the blood flowing and has a calming effect on the body. The physical therapist should do their best to detect if the patient would benefit from seeing other providers alongside themselves and make appropriate decisions on whether or not they can treat all aspects of the patient's pain. Luckily, physical therapists are equipped with professional knowledge on using manual therapy, movement, and exercise to treat the patient at a relatively low cost compared to other providers. A common misconception is that when patients go to see a physical therapist for pain, let's say for the for example, they only treat the hand. While of course the hand should be taken into account and should be addressed, in reality the whole patient should be taken into account as there may be other outside factors that cause the pain. For acute pain, most of the time the treatment is pretty straightforward with exercise and manual therapy, but for chronic pain, there are typically those outside factors such as stress, fear, the patient's mood, sleep, or a lack of support from other people that also need to be treated. Multiple body systems can be affected for with chronic pain, like the immune system, breathing, the sleep cycle, and digestive system. This is where collaboration with other providers such as psychologists, counselors, psychiatry, dietitians, and primary care doctors come together to work with the physical therapist to treat the patient. So let's set the scene. A patient comes in to see a physical therapist that has had chronic hand pain for months due to high levels of stress, and they're fearful of moving their hand because of pain. Um, what are the steps that physical therapists should go through to treat them? Well, luckily there is a step-by-step way to approach this, starting with education, laterality training, motor imagery, sensation differentiation, mirror therapy, and finally exercise and movement that is specific to what the patient wants to get back to. For education, the physical therapist should have a deep conversation to teach them about how the pain works in the body by using metaphors. So, an example of this would be that doorbell ringing, which is sending signals to the brain, and the brain is interpreting it as there's danger outside of the door, aka pain. For this particular patient with chronic hand pain, they should be educated on how the doorbell uh, is kind of having a mishap and is causing the doorbell to keep ringing even when danger is not there. From there, the physical therapist should describe what treatment will consist of and give them a positive outlook on reducing their pain. Next is laterality. This is where apps or pictures of body parts such as the hand can be used for uh, the patient to work on finding the difference between right and left hands. Remember when we talked about the pain smudging or the brain smudging and how the brain can be a little confused on what body areas it's sensing? Laterality training is extremely helpful for the patient to improve the ability to remap those areas in the brain to understand what it's actually looking at and feeling. Next is motor imagery. The end goal is to get the patient back to moving normally without fear of pain when they move. Motor imagery is basically imagining that certain body parts are moving without actually moving them. An example of this would be that you close your eyes and imagine gripping a stress ball for 3 sets of 10. This can be a great start before actually getting the patient to move, to help them visualize that they can move without pain. From there, the physical therapist would help the patient with sensory differentiation exercises. This is where the patient's ability to feel different types of textures, objects, and trying to pinpoint where they're feeling things is actually practiced. For example, the physical therapist could have the patient reach into a bucket of objects with their eyes closed and have them try to guess what they're feeling. This step also builds that remapping in the brain areas, so your brain better understands where the sensations are coming from. Mirror therapy would be next. This one is very interesting because what you do is you basically have the patient sit or stand in front of a mirror that's splitting like half of their body, to where they can only see one side. So like if I set the mirror here, they would only be able to see this side of their body. So for the hand example, this is where the patient can do different movements with their good side, and when they watch the mirror, it actually looks like the the painful side is moving. This tricks the brain into thinking that you're actually moving the painful hand when really you're just moving the other hand. After all of these steps, the patient should be able to start slowly doing the movements and conditioning exercises that relate to what they like to do in life that was first limited by their pain. In the beginning of these conditioning exercises, they may be very simple where you only try to flex your muscles and try to hold that and not actually move your body, which can actually help you relax and decrease pain. Many times, the physical therapist will use the pain scale where the patient rates uh, their specific feelings on the movement on a scale from 0 to 10. This is a great tool for the patient because they can gauge how they feel and understand the progress that they're making. Also, it helps the physical therapist educate the patient on building tolerance to a movement. For example, when they tell them that they can squeeze a ball to a tolerable pain, they can tell them to try not to go past a 5 out of 10 pain. Um, and once they hit that threshold, then they kind of back off a little bit and go ahead and do it again until they reach that 5 out of 10 pain. This is a rehab process that may take weeks to months, depending on how the patient progresses with relearning that they don't have to be in pain all the time, and they can actually take action for themselves. By the end of all these steps, you should expect resolved pain, strategies to reduce it if it comes back, and a sense of strength and resilience mentally and physically. Overall, the main goal is when it comes to treating pain is to gain a full understanding on what you can do about it and learning the next steps to take action on. With all of these steps that the physical therapist will bring you through, it may be overwhelming, but with education and simple movements, it should seem straightforward and attainable to on what you can change in your life to control your pain. I would like to take the time to thank you for watching, and I hope that you have a better idea of the science of pain and how it can be managed.